We're going to do an intramuscular injection, and more specifically, working with the Vanish Point syringe when we administer Narcan to our suspected narcotic overdose. Before you begin, there is equipment that you will need. First, you need your Sharp Shuttle. You do need your 3cc Vanish Point syringe. You need some alcohol prep pads, Band-Aids. Of course, you will need your Narcan. So before I begin this skill, I want to make sure that I do take body isolation precautions, personal protective equipment. Ma'am, do you have any known allergies?
No.
Great. Since I am going to administer Narcan, I want to pick up my vial, make sure that the seal is intact, that it is in fact Narcan, that's what I want. I want to make sure that it is a concentration of 0.4 milligrams per cc. I'm going to check the expiration date, make sure that it is not expired. And I also want to look at the drug itself, make sure that it is clear and that there are no particulate matters floating around in my vial. At this time, I would take one alcohol prep pad. I would go to my patient's medial deltoid, which is in the shoulder area. I'm going to take my fingers and pull that skin nice and tight. And like a bullseye, start from the center, making a circular motion, working outward. While that's drying, once again, I've now broken my seal on my Narcan, which is the concentration of 0.4 milligrams per cc, non-expired. That is in fact the drug I want. Good practice to also check your other pieces of equipment and make sure that it is not expired as well. I do want to pressurize my vial before I drop my drug into my syringe. So I'm going to pull back the plunger in the syringe, maybe to about half a cc. There is no hard and fast rule on exactly how much air. Hold my vial upside down, letting gravity pull all of the drug to the top of my vial. I'm going to push the plunger, pressing all of the air into the vial, pressurizing it. And I know that after I've done my drug calculation of want over have, what I want to drop in my syringe is in fact 1 cc. Now I also want to make sure that I expel all of the air bubbles from my syringe, so I'm going to pull my plunger back a little bit beyond 1 cc. Tap on the syringe to get all the air bubbles to float to the top. Expel all my air. Push the plunger up to the 1 cc mark. And now I'm ready to administer my Narcan. I'm going to come back to my patient's injection site. IM injections are done at a 90-degree angle. 1, 2, 3. Now before I push my medication into my patient, hold the syringe. I'm going to pull back on the plunger and aspirate for blood. If you see blood, you do not want to be in a vein. You want to start all over and not administer this drug. I do not have any blood at this time in the syringe, so I'm going to administer my Narcan to my patient. Because this is a Vanish Point syringe, we're not going to pull it out. We're going to activate the safety device by now pushing the blue button at the end of the plunger, leaving it in my patient's arm. The needle now retracts. This immediately goes into the Sharp Shuttle. At this particular time, good patient care, especially if there's any bleeding. Cover the injection site with the Band-Aid. And now I'm going to document the name of the drug, which was Narcan, the dose or the amount that I gave my patient. I'm also going to document the time that I administered my medication and the route, which was intramuscular injection. It's also a good practice to document the man number of who gave the IM injection.